will be performing a renal and a GI assessment. And I'm doing the GI assessment. The first thing you want to do is note the skin on your patient. I'm going to check the abdominal area and check for symmetry on both sides. I'll go ahead and auscultate the 4 quadrants. Want to listen for at least 5 to 15 seconds. If you note bowel sounds that are very short and quick, shorter than 5 seconds, that would indicate hyper bowel sounds. If they go long, beyond 15 seconds, or they take, it takes longer to hear them into your to hear them, that would mean hypo bowel sounds. You would listen to each quad for 5 minutes. Also, while I'm listening, I will go ahead and I'll listen for abdominal bruits. This is the aortic. You have a renal, iliac, and we also have the 2 femorals. They're located in the groin area, 1 on each side. Next I want to have you do is to lie back. While I was checking for the abdominal bruits, if I'd heard any significant turbulence, that would indicate a narrowing of the arteries. In that case, most of the time if you hear a murmur, you need to go back and reassess the heart, because it could be that the sound has just radiated lower into the abdomen. So at that time you'd want to go ahead and reassess the heart. Now we're going to check the abdomen using percussion. The normal sound that we should listen for is tympany. Tympany is noted in hollow organs. So that's what we should hear. And you're going to do it twice to the quadrants. I'm using my I'm using my middle finger and raising the others off of the abdomen. And tympany was noted throughout. If there was a dullness noted, it could indicate solid mass. It could indicate a fecal impaction, or it could indicate an enlarged liver. I'm going to palpate at this time. Light palpitation. In this one, we're just going to do it lightly, checking for any tenderness. And as I'm doing this, I'm watching my patient's face, making sure that he's not grimacing. We'll do deep palpitation. In deep palpitation, we would note any rigidity. It should be rubbery and bounce back, because it's not rigid or in any way. But when we do deep palpitation, we're going to check for mobility. We want to check the size, location of any mass that would be there. So deep palpitation here. Going about a 1/2 inch. And once again, you'll note the patient's face to see if there is any grimacing or tenderness to this check. Also, when you hear, you come about the iliac crest, and on the right side, and you'll check here. This is McBurney's point. A positive check here would be an assumption of appendicitis and further studies would be needed to go ahead and assess that. I'm going to have you sit up. Alright, in checking the renal, we want to ask the patient about their health history, and you want to get an in-depth health history on the patient. Make sure they didn't have any diabetes mellitus or medication, what medications they were on, if he's had any fever or chills, any back pain. And once you've done that, if there was fever and chills, he probably could have had a UTI, or with the pain to it, it could have been kidney stones. So upon doing the physical exam of the renal, much of it was covered in the GI check, but you want to make sure that you inspect, auscultate, palpate, and percuss the organs. When you feel in the lower abdomen, you should not be able to feel the urinary bladder, even stretched to capacity and feel it should not be that high up. If you will, spin your legs this way. We're going to check the costal vertebral angle. I need your legs up here. Okay. And checking this, I'm going to do direct and indirect percussion. And if you're checking along the back, you should not feel the kidneys. If I could palpate the kidneys, and if there's any pain to me touching it, that would be indicative of polynephritis. But with direct percussion, and then indirect. Okay, this concludes my video assessment of the renal and GI assessment.